This is New York Nightly News with Chuck Scarborough.
You mentioned the elevated pollen count. First day of spring. Get ready to hear a lot more about allergies, especially with the warm winter we just went through. Joining us now to talk about it is Dr. Josh Werber, an ear, nose, and throat specialist from St. Francis in Roslyn on Long Island. So allergy season a month ahead of schedule? What's going on?
The warmer weather encourages blooming of the trees a little early. So our weather pattern now is more like a typical southern weather pattern. So you're seeing earlier blooming of trees and therefore higher pollen counts. Right now, especially maple and elm are starting to be seen. And so people are it's gonna be a longer season. So there's unfortunately gonna be a little more suffering this year.
Now, as a longtime allergy sufferer myself, normally I get the watery, itchy eyes in late April. Just started to detect it the last couple of days in mid to late March. How bad a season is this going to be?
It's going to be bad, but there are things you can do to counteract that. Like someone like you should be starting to take an over-the-counter antihistamine now. It's much better to treat this prophylactically than to wait till you have significant symptoms. There are a lot of great products, both over-the-counter and by prescription.
With the eyes, where do you stand on like the Visine? It does tend to act as an astringent and dry it out, and then in a little while you're just dying to itch your eyes. What do you do?
Right, there actually are prescription products that are a little better than that. They're a little more specific. They have an antihistamine in them, which is what the over-the-counter products have. So that's going to be more effective for you, and those last all day.
One thing I've always wondered about, when you have allergies, does it make you more susceptible to get a cold or something like a virus?
Well, it makes you more susceptible to getting a sinus infection because you get swelling of the passages, so poor drainage, and then that can lead to sinusitis. So indirectly, yes.
Because it's like a nonstop thing. You hear somebody coughing and sneezing in your office and they go, it's just allergies. And you know at a certain point that it's a sinus infection.
Right. There's a lot of crossover in terms of symptoms between allergies and a sinus infection. Normally, an infection, there'll be pain, there might be fever, and there'll be some color to the mucus, whereas allergies is going to be more thin, watery mucus and a lot of itching.
Now, since it's been warmer than normal, what if we got a sudden frost in 2 weeks? Might that help things and send us back on the normal time scheme, or is it too late?
I think it's too late. I think it's at this point, this has already been set in motion. And so once the trees already start to bloom, then that process carries forward. There may be a slight little delay, but I think we are going to have a longer season this year.
Dr. Josh Werber, thanks for spreading the allergy doom.
Thank
we appreciate it. All right.
Take care.